bring you in, Stefania, and invite you to share your experience as a young person and now as an adult in the role of caring, because I know you're going to touch on a couple of issues that were highlighted in the chat. People spoke about the challenges, the stigma and taboo around mental health, and I know that's a particular area you want to touch on. So, Stefania, tell us your story.
Good morning to all. Thank you for being here. My name is Stefania Buoni. I live in Italy and near Roma. I am a former young carer, now adult caregiver, and I am the president and co-founder of COMIP, Children of Mentally Ill Parents NGO, which is the first one in Italy created by and for daughters and sons who have parents with mental health problems. And we work for advocacy and raising awareness among the general public. And we work especially with severe mental health problems of parents like schizophrenia, bipolar disorder, and major depression. When I was a teenager, both of my parents started suffering from mental health problems. And mental health nowadays still doesn't have the same dignity and respect that physical health has. This is called stigma. And it was a huge problem for me as a daughter. It was hard to get help, even harder to talk about it. I felt completely invisible, and I was. There were no information in schools, nor in the GP's studio about mental illnesses. So what happened didn't have an explanation, nor you didn't know where to turn to for help. I had no idea I was a young carer. I didn't feel like I was caring for my parents. I just felt like I was surviving to something bigger than me, and I felt scared for me and for my parents. I didn't know how I could help them get better. You cannot force treatment on someone by law if they don't know they need help and they refuse treatment. This also happens because we, as a society, we don't talk openly about mental health as an important part of our lives. There is shame, prejudice, judgment, and the feeling that it is something to hide because you still have consequences in your workplace if you say you have a problem of mental health. This is the truth. And also for the rest of the community. And the consequences of this big, huge taboo completely fall on the shoulders of young carers. Because you, as a young person living with your family, with your parents, you feel that it is safer to keep the secret because the consequences of talking outside the family are worse. You can be labeled as a victim or as inheriting the mental health of your parents because of the prejudice of genetics. Whilst the ambient, the social environment plays a huge role in the outcome. Also, you can be labeled or bullied in school. And also you can be accused by your family to cause embarrassment to them if you talk about their problems. And also, parents might see their children taken away from them as bad parents. So, and also, if your parents doesn't have a diagnosis because he or she refuses treatment because of stigma, you fall completely out of the radar. You have no rights to support as a child. My parents only got in treatment after a severe crisis where they were at risk of death, suicidal attempts. I had to experience severe traumas due to the lack of preventative intervention and the silence and shame caused by stigma. I didn't receive any support in my transition to adulthood, no psychotherapy, no support for education and employment, and no support in school. There was no awareness. This needs to change. 25 years later, as an NGO, I unfortunately still receive from young people all over Italy the same messages I would have sent when I was 15. Despite our intense advocacy work and efforts, which is costly for us as survivors, we are survivors. And there are huge differences between the north, the center, and the south of Italy. So it's a matter of luck where you are born if you receive help or not. And this has to change too. In Italy, only 3% of public money is invested per year in mental health. too scarce to grant the basic human right to mental wellness. We need to raise it to at least 10% in 5 years to ensure more resources are invested in prevention and quality support for families. Free of charge psychotherapy and support for education and employment should be available to young carers and young adult carers, because often they cannot afford to pay for private psychotherapy, which is needed to ensure they can thrive in life and overcome the traumas. So I want to point out that resilience is not an individual responsibility, it is systemic. You can be resilient, but you need to be supported. I paid a high price and still paying it for being a young carer. I did not choose to be one. I am now fighting for the next generation, and we together are paving the way for the future. I want to point out that if you have parents with mental health problems, you don't have to be a caregiver for them because it's something too big, even for an adult. So it's not possible to leave these daughters and sons with this huge task on their shoulders. So now the adolescent Stefania that I have been is now giving voice to all the hidden young carers who don't have a voice because of stigma and shame. And is asking now from all of us together here for commitment to join forces and prevent any other child or young people to suffer the way I suffer. We can do better. We have to do better. We can help millions of families worldwide because it's a worldwide problem, this taboo. Mental health is a common human right. Let's fight together to end the stigma and make prevention and mental wellness our government's priority. Thank you.
Thank you, Stefania, for sharing your experience, and it's a very powerful message. And indeed, mental health is far more common than we would anticipate. The European Commission's documents show that as many as 1 in 4 people in Europe will experience a mental health challenge at some point in their life. And as you also highlighted, mental health services are the Cinderella of health. They get very little political priority, very few resources, and they're always overstretched. And so there's never enough support that's available, even though it's predictable. We understand now the burden on our society of mental health, and the taboo and the stigma for families and children experiencing that, I think, is really important.